What do you think the biggest challenges are for female health in particular?
I think one of the biggest problems that women have as they get towards middle age is something called estrogen dominance. This is a situation where there's an overabundance of estrogen in the body, and it's not counteracted by progesterone, which is a hormone that starts to fail in middle age. It's the first hormone to actually become reduced in the body, and that is exacerbated by all the estrogens in the environment. We call them xenoestrogens or foreign estrogens. These are chemicals which are present in plastics and fertilizers and pesticides, things like BPA, which you've heard of, PCBs, which are chemicals, polycarbonate chemicals. And these all have an estrogen effect on the body. And that is, we think, is one of the reasons why women or young girls are going to puberty much earlier, 7, 8, 9 these days, and the reason that men's fertility is dropping, because of the excess estrogen suppresses sperm quality and sperm counts.
Okay. And as a woman's going through perimenopause, we call it, don't we, when ovulation is fluctuating, what sort of impact does estrogen dominance have on them?
Well, it could cause all kinds of problems. First, they can gain weight. This is the reason why women put on weight around that time, particularly around the middle and the thighs. They can become anxious. They can have hot flushes. They can have problems sleeping. Depression is common. Dizziness, high blood pressure. Yeah, all the things that can happen to women in middle age. And estrogen is it's a wonderful hormone. It's very important to prepare the uterus for pregnancy. But outside that, it can be a bit of a nuisance.
And what about cancer risk as well?
Yes, that's another risk. High estrogen levels obviously are going to stimulate breast tissue and increase the risk of breast cysts and down the line cancer, yes.
Why do you think that thyroid hormone is so essential to get right?
Because the thyroid is the engine of the body. It's important for metabolism. If it's underactive, we feel slow and sluggish and cold, and if it's overactive, we feel hyper and warm and not very well. Okay, so yes, the thyroid is vital.
And what happens to it as we get older? Our thyroid function?
Like all the organs of the body, it would decrease as we get older. But on top of that, of course, we have stress, which can crash the hormones. We have changes in sex hormones, which can affect the thyroid as well. We have industrial contaminants, pollution. The thyroid is a sitting duck for pollution, because you're walking down the road next to the traffic. It's there, it's open, it's exposed, and it can suffer a lot from contamination.
And what are the consequences of contamination and things like that? What happens to it?
This is where we go back to autoimmune diseases again, because one of the most common causes of underactive thyroid is something called Hashimoto's thyroiditis, discovered by Dr. Hashimoto, a Japanese doctor many years ago. And this is a condition in which the body mistakes its own thyroid for foreign tissue and produces antibody against it, which attacks the thyroid and causes it to be underactive, to reduce its amount of hormones. And that can be helped with by identical, again, natural thyroid hormone.
And the difference between natural thyroid hormone and synthetic thyroxine that you would get from your regular GP?
Yeah, well, thyroxine. There are four hormones in the thyroid gland. T4 and T3 are the most important ones. Thyroxine from the drug company is T4 only, and what can happen is that when the thyroid is underactive, working properly, we sometimes lose the ability to turn that T4 into T3. T3 is the active hormone in the body. T4 is inactive; it has to turn to T3 in the body to be effective. And a lot of us don't do that conversion. So if you just give T4, thyroxine, then you don't convert it to T3, then you're not going to get a boost in thyroid function.
Okay.
So what I like to use is whole thyroid or armour thyroid. It's desiccated. It's made from pig's thyroid, and it contains all the T4, T3, T1 and T2 as well, which are not quite so important. But then you're giving the body the whole thyroid armament, if you like.
Right. I know when I went to my doctor recently, he only tested my TSH and T4. I couldn't get my T3 tested, which seemed a bit crazy to me because I didn't know, might not be. That's the important one, isn't it, the T3?
Yeah, it's also important to have free hormones, to use free thyroid hormones, because a lot of them are bound to proteins and they're not available for the tissues to use. So you need to do free T3, free T4, TSH, And sometimes there's also something called reverse T3, which actually goes up in the blood when T3 is actually turning back to T4.
It's a really complicated gland, isn't it, with lots of different variables when you get tested, isn't it? So
Very much so, yeah.
Very important to go to someone who knows what the problems can be.
And also it's very important not to rely too much on thyroid testing.
Yeah.
The blood tests themselves are pretty inaccurate. If you talk to a sort of orthodox endocrinologist, he will look at your TSH, and if it's under 5, he will say that you're normal.
Right.
But people in my field will tell you that a lot of people with a TSH of 4 or 5 are going to feel as though their thyroid is underactive.
Right.
And so I look at optimal rather than normal. And most practitioners who do what I do now would say that the thyroid TSH should be under 2.
Right.
And what I also tell patients to do is to take the basal temperature in the morning.
Yeah.
I take it sort of 3 times during the day and do an average. And that's if your basal temperature is low, then it usually means that your metabolism is low and your thyroid is not working properly.
Okay, so your temperature in the morning is a good indicator of whether your thyroid is functioning well or not. So that's a really good test to do at home.
Yes,
if you can't afford a private blood test or something like
sure,
that.
it's an easy test to do.
How does a stressful lifestyle affect your thyroid?
Mainly by affecting the adrenal glands, because the adrenal glands are the stress glands in the body. They govern the fear and flight reaction. We're only supposed to have stress that occurs very rapidly or suddenly, and we have a burst of cortisol from the adrenal glands to get over that, and then once we run away from the stress, we stop and the cortisol levels drop again. But if you're in constant stress, in everyday life, emotional problems, financial problems, work problems, whatever, then that cortisol level is not going to drop. It's a bit like putting your foot down the accelerator of a car. The engine revs and revs and revs and revs and revs. Eventually, it can't work anymore.
Right.
And that applies to cortisol from the adrenal glands. It will produce to excess, and then the adrenal glands get tired and can't produce anymore. That's when you go from being wired to feeling tired.
Okay. And what does too much cortisol in your body do to your thyroid?
To the thyroid gland, well, it'll suppress the thyroid gland and make you feel tired, stressed, tense, anxious.
So it kind of makes the whole situation worse.
Yeah, because the adrenals are the conductor of the orchestra. The thyroid is one of the players. That's how I look to it. Unless the conductor's conducted properly, none of the other glands work.
And how can we support the thyroid with diet and lifestyle as well as hormones?
First of all, you've got to make sure that you don't take up too much sugar, okay, and that you get exercise. The thyroid likes exercise, regular exercise. You've got to make sure that you don't eat too many what we call goitrogenic foods, things like brassicas, cauliflower, broccoli, because they can actually stimulate the thyroid too. Not so much if they're well cooked, but generally speaking, if they're raw, they can cause problems. And certain supplements help the thyroid. Iodine is very important. Most of us are short on iodine. Tyrosine helps. Selenium is very important. I think you also got to make sure that if your thyroid won't work properly, as I said before, until your adrenals are checked, so they go in tandem. I never treat somebody's thyroid without making sure the adrenals are not working first.
What is perimenopause, and why do you think women don't even realise they're going through it?
Yeah, well, perimenopause is the 4 or 5 years before the actual menopause, which is the cessation of periods. And it's a time when women's hormone levels fluctuate rapidly and erratically. Because, as I said before, the first thing that happens is that as women get to the sort of middle and late 30s and onwards, they stop ovulating regularly. And when you don't ovulate regularly, you don't produce a hormone called progesterone. If you don't produce progesterone, then you have estrogen dominance. Estrogen is still produced because it doesn't stop being produced until the ovaries cease to function at the menopause itself. And so you can get high levels of estrogen and low levels of progesterone, and that can cause all kinds of problems. And women, I suppose, they maybe think they're just getting older, or maybe they think that the stress in their life is causing all their symptoms. But I think that perimenopause is becoming more and more not, I suppose, acceptable, at least known about than previously.
I think a lot of women feel like they're just too young to be going through that yet, you know?
correlate the menopause with period stopping, you know, and hot flushes and sweats and things like that. But it's much more insidious than that. It starts several years before, and just minor change of hormones can affect a woman's memory, energy levels, libido, all these things which are important. Yeah.
Yeah. As well as the hot flashes and the night sweats.
Yeah, yeah. Well, that tends to come a bit later on when estrogen levels drop.
Now, some women really suffer and others don't suffer at all. Why do you think that is?
Yeah, well, I think it depends on firstly their attitude. A lot of women who are, you know, will just sort of go through, just accept the symptoms and go through them and not affect them very much. Other women are more vulnerable to it, psychologically more vulnerable. It appears that women who have a certain amount of adipose tissue, a little bit plumper than others, tend to hang on to their hormones longer, and they feel less uncomfortable.
So being a little overweight is a good thing?
Yeah, I think research says that you know, being a little overweight actually is good for everything. It's been, you know, obese that the problem comes.
Yeah.
Yeah.
What got you particularly interested in hormones?
I got older. I think as you get older, you have a vested interest in making sure that you age, obviously, more healthily and slowly. And what you find also as your patients age with you, you attract the patients of your own age. And I was finding that I could help a lot of people with chronic diseases, things like diabetes, hypertension, heart in the arteries, by arthritis, by restoring hormone levels to I notice said normal, but what I mean really means sort of premenopausal levels.
Right. So not young. You don't want them to be going back to their 20s.
No, I don't think that's the right thing to do, because you'd have to give such high doses that have side effects. No, you restore them to a sort of premenopausal level, okay, and then all the disease of aging will slow down. Okay, hormones are anti-inflammatory. They help the bones, they help the brain, they help the arteries, and therefore aging then is much slower and more healthy. Women and men on hormones, they look better, they feel better, and they have less likely to have illness.
Why are hormones such an integral part of health when, you know, they possibly don't get the attention they deserve, do they, from the medical?
Well, not just that, they've had a lot of bad press, of course, because following the Women's Health Institute 10 years ago, I think it was now, when they took 25,000 women on Premarin, which was a sort of synthetic estrogen which is derived from pregnant mare's urine, and they followed them up and they found that they had, particularly if they were taking a certain synthetic progesterone as well, that they had increased risk of breast cancer, heart disease, blood clots. And after that, HRT got a very bad name, bad press, and we took it knocked back the progress of HRT at least a decade. But now I think we're coming around to the fact that as long as you use bioidentical hormones, natural hormones, belong in the body, not synthetic, then you're doing the body a service by replacing them.
And what is the difference between synthetic and bioidentical hormones?
Bioidentical hormones are the same composition as the natural hormones in your body. Right. Okay, they're made from Mexican yams and soy, and they're then converted in a laboratory to the natural hormones. And this is in direct contrast to drug hormones, which are made by pharmaceutical companies, and they're synthetic. They're not natural, and often taken orally, which again is not good for HRT. And what they do, they sit in the natural receptors in the body, in natural hormone receptors, a bit like a square peg in a round hole, and so they prevent them from working. And also, while they're sitting in these round holes, they actually produce lots of metabolites which are not good, which cause all kinds of problems. So one should never take drug hormones, never take oral hormones, apart from progesterone capsules, micronized progesterone capsules, which are quite safe.
So do you think there are any dangers in taking bioidentical hormones? I mean, for instance, you can buy progesterone cream on Amazon these days and anyone can use it. Do you think there's risks there?
Yes, because one of the problems with progesterone, of course, is often the dose is too small rather than too large. And if you have a small dose, then you're going to get all the... what it does, it triggers the estrogen receptors and you get all kinds of side effects from it. It's safe, no one's going to come to any harm for it. There's no evidence that it can increase the risk of breast cancer or any other problems. But progesterone is a very, very safe hormone, both for men and women. and even in high doses, it really does cause problems. But you have to. I mean, hormones have to be monitored. You know, you try and get it into the normal range without taking too much, because you'll get side effects. You're trying to be physiological. You're trying to have the same levels that your body would produce naturally at that time of your life.
And you can't do that on a self-prescription basis, can you? You need to see somebody who knows what they're doing.
Yeah, you should always get your hormone levels checked so that you know which ones to replace. You know, for instance, if you give estrogen without progesterone, then you're just compounding the problem and increasing your risk of breast cancer. So it's all about balance. Mm-hmm. I like to call it hormone harmony, where you get everything. All the hormones have to be balanced to work properly. Mm-hmm. There are 14, 15 hormones in the body, and they all have to work in harmony, in concert, for the body to work properly, for the patient to feel well. Mm-hmm. So it's not a good idea to self-treat yourself, because you really don't really know what you're doing, and you're not sure that giving one hormone, you put another one out of balance. So it's a question of, I think, of going to somebody who knows about hormones.
It's a very delicate balance, isn't it?
Yes.
Do you think bioidentical hormone therapy will ever replace HRT?
One could hope so. Yes, it's always a dream that will happen. But I think more and more women, particularly, are realising the benefits of bioidentical hormone replacement, and asking their doctors for it. And if they can't get it through the doctor, they're then going to other practitioners who can do it. Yeah. So I think it is certainly it is taking off, and women feel so good on it that they I think the message will get around.
Do you have any advice for women who have hot flushes and night sweats but don't particularly want to take hormones?
Well, the best treatment is balancing hormones. But if you can't do it, if you don't want to take hormones, or you can't afford hormones, then you can take things like black cohosh. That works for red clover. There's a tablet product in Europe, I think in America, called Remifen, which is black cohosh, which is I think you can buy that over the counter. That's successful. It helps. Sage also helps. Okay. And things like vitamin E and fish oil are also very good. Okay. But at the end of the day, I've not found in my practice that they work as well as the natural hormones.
Yeah. Okay, that's great. What other advice would you give to women going through the run-up to menopause?
Okay, make sure you have a healthy diet, lean meat, lean fish, lots of fruit and vegetables, and keep down the sugar, keep down refined carbs, and get some exercise. Exercise has been shown to really keep the hormone levels up. In fact, exercise is the biggest way of increasing testosterone levels, as women also lose testosterone as they get older. And and make sure you keep the stress down, and you lead to, you're emotionally happy and you're sleeping well. Yeah.
Easy.
Simple.
Thank you very much, Dad, and Dr Bernard
welcome.
Willis. And if you want more information on him, you can go to drbernardwillis.com. And thank you very much for watching.